Hi, my name is Jami Steger, and it's a pleasure to be here today. I'm going to be talking about post-kidney transplant and what to expect. I'm currently a nurse practitioner at Sanford Children's Hospital, and one of our nurses, Regina, also helped prepare these slides. So I want to make sure that she gets a little bit of credit as well. And with that, we'll start. But the first major thing is, not even just immediately post-operative, but what does getting the call look like the day of transplant? So I wanted to touch a little bit on that because that might be a cause of stress for families as well. So when you get the call, let us know right away if your child has a cough, runny nose, sore throat, fever, diarrhea, vomiting, or any new symptoms that may be worrisome to us at the time of transplant. Also, let us know if you are on dialysis at the time of the call or when your last dialysis was. Some patients may require a dialysis treatment prior to receiving the transplant. Be prepared to let us know when your child last had anything to eat or drink, and also be prepared to know what to do if you need to disconnect your child from PD or who you can call to get instructions on how to properly do that. Also, please note that sometimes we bring patients in and the transplants get canceled. We try to tell families that nothing is 100% a go until our surgeons have the kidneys in their hands and they are able to visualize. We want the patient to have the best donor kidney they can get, and sometimes that means when we actually look at it, it may not be appropriate for your child. Then let's move into the operating room. The surgery is usually around 3 to 6 hours. Again, this is an average, but most of the time that's what we have parents anticipate. Your child will have a big IV, usually in the neck, many small IVs, a Foley catheter, and a JP drain. The Foley is usually removed 5 days post-op, and your child must void within 2 hours after removal. The JP drain is removed by the first surgical team prior to discharge, and this is usually around post-op day 3 or 4, depending on how much drainage there is from that. You may or may not have a breathing tube when you wake up. Most breathing tubes will be removed prior to leaving the OR, but some kids may need a few days post-op, so just beware that sometimes your child may have a breathing tube. Another tube that you may see coming from your child is an NG tube, and this runs through the nose into the stomach, and this will be in place until bowel function returns, meaning your child has a bowel movement or your child may pass gas or burp or be tolerating food. HD lines may remain and to be removed at a later date. Do not be alarmed. This does not mean that your child needs dialysis. It will just be removed at a later date and time. PD catheters are usually removed at the time of transplant. Your child will wake up in the ICU. Our typical ICU stay is usually around 1 to 2 days. Your child will be connected to monitors to measure their heart rate and their blood pressure. There will be more frequent vital signs, strict intake and output measuring, and daily rounds will consist of a large group of people who will be at your child's bedside. We do have a handout that you can access indicating the people that you will interact with and what their roles and descriptions might be if you want to refer to that at a later time. Where will my new kidney be? Most of the time it will be on the right lower side of your abdomen. For some patients, it will be on the left lower side of the abdomen. This will be decided by the surgical team, and it will be decided prior to the day of transplant. Child will also have a ureteral stent. This is not visible. At the time of transplant, it is placed in their ureter that connects to the bladder, and this helps the bladder drain as the healing process continues post-surgery. This usually remains in place for about 3 to 4 weeks after your child's transplant. The removal is done in a day outpatient surgery and usually with anesthesia. Most children will require an ultrasound after the removal of the stent to make sure they are still emptying their bladder completely and preventing urinary retention. How long will I be in the hospital? For our older patients, the average stay is about 5 to 7 days. For our younger patients, the average stay is about 2 weeks. But remember, these are averages. Everyone is different. The hospital stay can always be more or less depending how your new kidney is working, how you are feeling, and how you are understanding the new concepts of kidney transplant. Pain control is probably something that a lot of parents worry about for their children. If your child has to have their native kidney removed, they may have experience more pain than others, and we always take that into account at the time of transplant. Good pain control is not only important for the child's well-being, but it also helps with good blood pressure control. It will help encourage your child to get up out of bed, and it will help your child tolerate their fluid goal. Your child may have a pain pump or something called a PCA immediately after surgery. They will then move to an oral or by-mouth regimen to include Tylenol. For kidney transplant, Tylenol is okay, but we do not like NSAIDs, for example, ibuprofen. Teaching. So teaching will start soon after surgery when your child is stable, usually post-op day 1 or 2. You will learn about your new medications, safe living after transplant, and what to expect the first weeks and months after transplant. You will also learn about how to take care of your child's incisions. The RNs and surgical team will help lead this education and guidance on incision care. However, in most cases, you can expect that your incision will be on your lower abdomen. Showering is acceptable with the surgical site healing. We do ask that you avoid submerging the incision underwater, as it is not recommended to soak the incision. Children may sit in low-level baths as long as the water line is below the hip, and they can sit up while bathing. Other kids can stand with their backs toward the water as they wash up. There is no need for special soaps. A mild soap is all that is needed to help wash the incision. Make sure to dry the incision completely after showering. The top layer of the incision will be closed with a surgical glue. This will vary by every center, and even some centers' surgeons will have different approaches on how to close the incision. But whatever is usually placed on top of the incision usually will peel away in 14 to 21 days. Before discharge, if you have any questions or concerns on how to properly care for your child's incision, please speak up. This should be included in your discharge summary and your teaching. It will also be able to go over when you come to clinic for the first time post-operatively. So what do you need to get ready for discharge? The most important for that kidney is to drink. Your child must be meeting their fluid requirement by mouth or by feeding tube if they have one. Fluid goals are unique to each child based on their height and weight. Meeting your fluid goal every day is important for kidney perfusion. You will need to meet this goal without receiving IV fluid supplementation. Your child will need to be urinating without difficulty at least every 2 hours as well to make sure that that bladder is empty and not going back into the kidney. If your child was having to use urinary catheters before transplant, this will likely continue after discharge as well, so do not be alarmed that the new kidney is not working. They must be stooling at least daily, eating a regular diet or tolerating their formula by feeding tube without difficulty. You must be able to check blood pressure, so you must have your own blood pressure machine that works well, and blood pressures are in target range. What that means is that your child's blood pressure, usually for younger kids, is between 100 to 120, and older kids, it's 100 to 104, or 120 to 140. The target is determined by your transplant team and again will be instructed to you prior to discharge. You will be provided logs to keep track of your child's blood pressure as an outpatient as well. Getting ready for discharge. Learn about your new medications. They will be different from dialysis. A pharmacist will review, provide a med list, and deliver the medications to you before discharge. Most centers require hands-on experience with the medications at the bedside before leaving. Most centers require parents or guardians to complete at least 24 hours of care, meaning they will call out and give medications at the appropriate time, be checking their child's blood pressure twice a day, and they will be monitoring and encouraging their child to meet their fluid minimum and urinate as instructed, which is usually every 2 to 3 hours, and that they are eating regular meals and giving G-tube feeds. Communication is key, so if there is something that you do not understand, please ask during this time. And then once you leave the hospital, you are not on your own, so just know that. 5 to 7 days may seem like a quick turnaround time for your child and their new transplant. If you do not live locally, you may expect your center for you to require to stay 6 to 8 weeks after transplant for close follow-up. This is because we require frequent clinic visits. In our center, immediately after discharge, that's usually about 2 times per week. That eventually gets spaced out as your child is more stable and you feel more comfortable taking care of the kidney transplant. During this time, there is lots of teaching that goes on, so continue to come to clinic with your questions and your concerns, your blood pressure logs, your fluid requirements, all those things. Just come to clinic. We're here to help. Your child will also require frequent lab visits, so at least with each clinic visit, your child will be getting blood work. Some important labs that we trend as an outpatient with the kidney transplant are your child's creatinine, your child's electrolytes like magnesium, potassium, and phosphorus, their hemoglobin and hematocrit, their white blood cell count, and then the new medication, their tacrolimus level, will be tracked every time your child gets blood work. As more time passes, lab draws will become less frequent, and most centers will require monthly labs at least for the life of their following at the transplant center. Some important things to remember and to bring to your clinic visits are your blood pressure logs, your fluid logs, your medications, and your medication list. And my last slide is just, I know there's a lot of questions and some of the other things will be touched on in this seminar as well, but some of the main questions that a lot of families ask are just some quick living tips, such as school. Before returning to school or daycare, check with your transplant team first, but it's usually okay for children to return to school or daycare about 4 to 6 weeks after transplant. Schoolwork can be a little bit harder for some kids after transplant, so talk to your team if you think your child might benefit from extra support at school, including help with behavior, keeping up with class, and other types of support. The school might need a letter to explain why your child didn't get some vaccines, and you can ask your pediatrician or the transplant team to give you this letter. The transplant team can also provide letters to your school to ensure that your child is able to drink freely and meet their fluid goal and has access to a bathroom to make sure that they continue their good voiding habits. And then the next little big spot about returning to normalcy for some kids and families is sports. So sports and exercise, we usually say kind of 3 months after transplant to let everything heal and to let that new kidney settle in a little bit. Most school kids can return to gym class and play non-contact sports like gymnastics, dance, baseball, basketball, soccer, and running. Ask your transplant team if it will be safe for your child to play sports before starting and which ones are okay. Sports approval may vary by center, so make sure you reach out to your transplant center. And make sure your child drinks plenty of water when playing sports. With any physical activity, there is risk for dehydration. And the one thing you will continue to hear from your transplant team is hydration is key. So keep that in mind as your child becomes more active. Please see our Healthy Living tip sheet for more information. If you have any questions, please drop them in the chat and I can help answer them at a later date and time. Thank you for your time, and I hope this has helped ease your mind a little bit about some of the post-transplant care of a kidney transplant patient.